Hi, I'm Joe Rogers, President and CEO of the Texas Heart Institute. I'm joined this afternoon by Lisa Wright, who's the CEO of Community Health Choice. And we've been talking this afternoon about the Walk 30 program and the things that you're doing personally to integrate exercise into your life, and then some of the things that you're thinking about in terms of stimulating our community to spend more time exercising. So we're very happy to have you. Thank you so much for joining us this afternoon.
Well, thank you. I'm very happy to be here.
Before we came into the studio, we had a conversation about your very busy life and your philosophy on exercise for yourself. And I thought it was a different perspective than we've heard from others who we've talked with about the Walk 30 campaign. I wonder if you wouldn't mind just sharing kind of your thinking about your own personal journey with walking and exercise.
Sure. Well, as I have to run a company every day, it's really important that I am present for not only my staff, but most importantly, I'm the mother of 2 kids under 7. So it's important that I'm here for them. And so as we talk about work-life balance, and I try to make sure that my team is focused on work-life balance and, taking PTO, one of the things that I realized for myself was that I had to be more selfish with my time. And for me, as a mother, I'm making certain that everyone in my family is getting to their appointments and that everyone in my family is exercising and taking the best care of themselves. And what I realized is that I probably was not taking the best care of myself. And so I carve out an hour every day for myself. And for that hour, I exercise. So I walk. Not only do I use that time just for walking, but also for meditation. And it gives me a chance to really sort of slow down my life and really think clearly about not only my day, but just about my life.
I think that we've heard a number of other leaders in the community talking about this relationship between exercise and the mind.
Yeah.
And I think it's probably something that we haven't spent enough time emphasizing, but there is this period of clarity when you really have a chance to just think.
Yeah.
And walking seems to, everyone that's commented on that
Yeah.
has said the same thing, and that is, I have this opportunity to clear my mind and really solve problems as I exercise.
Yeah, it's this great opportunity, at least for myself, to really be able to slow my mind down from just thinking about everything that I have to do, everything that's on my plate, everything that's coming up, to really take that moment and think about just the now, to be present and to really think about what it is that I need or that my family needs or that my company needs.
I think it's brilliant. So you have responsibility for over 500,000 individuals in the Houston community.
Yeah.
And you were talking a little bit about some of the exciting programs that you're beginning to think about or that you're beginning to implement to facilitate and foster exercise. Maybe you could just expand on that a little bit for us.
Yeah, so Community Health Choice, of course, we're a managed care organization, but I always say that we're more than a managed care organization because, we were built on our mission of not only looking at members from, a health-related, but more so from social. And what we really focus on is how do we institute, more of those social determinants of health in their day-to-day. And so exercise is a part of that. And so one of the things that we're thinking about is how do we start with adolescents? How do we start them out earlier thinking about exercise so they can really start to incorporate that in their day-to-day, and then they just grow up with it. And, the Walk 30 is an excellent way to do that because it's 30 minutes. It's 30 minutes a day, and it doesn't have to be taken all at once. You can break it up. And so not only that, but we live in Houston. We have great weather. And so it's easy to say, well, let's go out and do this outside and let's spend 10 minutes here. And so one of the campaigns that we're building is really something for our children.
I love this idea of focusing on our young people too, because I think so often we're assuming that our kids and our adolescents are healthy and they're getting exercise at school, but it's not the same as it was in the past.
No.
And so often during kids' free time, they're doing other things like working with, either doing homework, hopefully, or they're on their electronics and things, and they're spending less time being physically active. And so I think this is a great initiative to try to get our young people back exercising again, and have them recognize that it's a reasonable part of their life, and walking is something that they can do,
Yeah.
until they're quite old.
Right. And also it's a way for us to help just, we know we're not going to be able to pull all their electronic devices away, but how can we safely help them incorporate?
Yeah.
And so that's one of the things that we're looking at. But we know that they need to get out. We know that that leads to long-term, positive health outcomes. And so we want to start them as early as possible because we want kids to be on the right track.
Lisa, I can't thank you enough for coming in today to talk a little bit about your own personal journey with health and exercise and what you're doing for the community. Thank you very much. And I'll look forward to continuing working with you.
Thanks so much. I appreciate it.